Hello dear students, and we continue our lecture in the Propedeutics therapy, and today's topic is a Propedeutics therapy, the percussion. So this is the starting of the clinical examination of the patients, and one of the things what you will to do, and you need to do this very carefully and very good, this is a percussion. The percussion, when it's mean, is when the tapping of the body, oscillatory movements of the organs and tissue occur. The features of the percussion sound depend on the structures of the underlying tissue, conditions of the properties of the tissue, and percussion force. So this is the third thing from the what to build the percussion. So again, structures of the underlying the tissue, the condition of the properties of the tissue, and percussion forces. This is a typing of the body. So when you're doing the finger and you type to the finger and listen the sound, this is a percussion. The volume of the percussion sound is determined by this duration. The signs, ceteris paribus, fluctuations, and the greater amplitude damp. The height of the percussion sound is conditional concept. The complex structure of the tissue on the organ leads to the appearance of the large mass of the vibration in the different claviges. The percussion, the nature of the percussion sound, is compared with any iconic sound. The nature of the percussion sound over the organs of the human body, it's a pulmonary, the dump, the tympanic, and blunted. So this is a fourth type of the sound. But still, the nature of the percussion sound over the organs. So each organ have their own sound when you're doing the percussion. But also percussion depends if they have a diseases, both diseases in the several organs, the type of the percussion will change. The string of the percussion depends on the depth of the organ and the goal and objectives of the percussion. The pulmonary sound is obtained with the percussion of the chest, where the lung tissue is located. Here is the long, loud, and low. A dull sound is obtained with the percussion over the dense organ, like a heart, liver, spleen. So, it all. The tympanic sound is obtained over the cavity containing the air, like in the intestine, stomach. He is tall and loud. A blunted sound is obtained with the earthy combination of the light and right dense tissue, like a lung and liver, lung and heart and spleen. Now here on the computer, on your computers, on the slide, you can see that there's a sound with percussion of the chest. So the first, when you, in this part of the picture, it's the angle of the lung, and then the lung become to the spleen. You see? And then in the end, this is a round. It's an interstitial. So number one, so you see the sound will go through the muscle, through the ribs, and going exactly in the lung. So this is a clear pulmonary sound. Then second, it's a blunt pulmonary. So you see that there's a sound going in through the lung and then become to the spleen. And this type of the organs is different. That's why the sound will be blunt pulmonary. Number three, it's a dump. So this is a liver, the dump sound. And then number four, it's the blunt tympanic. So a little bit hard, and then the sound going to the interstitial in the air cavity. So here the same, but picture is, before it was like an X-ray picture, here it's a CT picture. And then again, in the first, number one, you see that's a clear pulmonary sound because the sound going just through the, again, the muscle, the ribs, and nerves exactly to the lung. And that's why this is a clear pulmonary sound. Second, it's a blunt pulmonary because it's touching the lung and the heart. Third is a damp because it's a sternum first. Then after the sternum, it's going heart. That is a blunt, dump. And number 4, it's a blunt tympanic. So the lung percussion, usually mostly percussion is using in the lung because the lung diseases and lung, due to this organ, we have a big surface. That's why we're very often using the percussion of that. When the percussion have two types of the uses. So we have a comparative percussion, it's a deep and strong, and tissue vibration zone is a 6-7 centimeters deep and 4 centimeter wide. In topographic percussion, it's a superficial weak. Tissue vibration zone is a 4 centimeter deep and 3 centimeters wide. Now, the comparative lung percussion, the goal of this type of percussion to identify pathological changes is percussion sound. So you're comparing the right lung and left lung. So that's why it's a comparative. You compare the sound in the several positions on the one side and do the same on the next side. The task of the percussion is determine the nature of the percussion sound. Compare the percussion sound to symmetrical section. Normal in the healthy person with comparative percussion, a clear pulmonary sign is determined. So what does it mean? It means when you're doing the percussion to the healthy person, if you're doing the percussion in the upper lobe of the lung, when you see this, when you hear the sound, the same sound must be in the opposite side. If the lungs, when you're doing percussion, the sound is different, it means that is on the one side they have a problem, or diseases, or some syndrome. The comparative lung percussion, the percussion sound changes may concern in the lung, or it's a seal, cavity, and increased airnesses, like emphysema. Surrounding tissue, like a fluid, air in the cavity. In the absence of the suspicion of the lung pathology, comparative percussion is carried out at the minimal required points over collarbones, under collarbones, in the second intercostal space along the parasternal line, in the first intercostal space along the mid clavicular lines, over the spleen in the shoulder blades, and between the shoulder blades. So this is the points of the percussion. So here on this picture you can find exactly points of the percussion. Please, students, because it's the introduction to the internal medicine, and the first of all you need to know about the healthy patient. So you need to know the normal sound. You can try at your home to do the percussion in the same position as you see on the slide, on your parents, on your brothers, sisters, or neighbors, and try to find the same sound on the lungs. So here you can find on this picture the point of the comparative percussion of the lungs and also the methodological prospect. So what finger you're putting, it's a pleximeter. The finger that putting on the body, it's a pleximeter. And how you need to do that. This is a point of the comparative percussion in the lungs on the back side. Comparative percussion, it's a pathological changes in the percussion sound. So what you can find when you're doing the percussion in the not healthy the patient. It's a dullness. It's a determined the comparison of the lung tissue, like a pneumonia, atelectasis, and pulmonary infarction. Absolute dullness is determined over the fluid in the pleural cavity, a lobar contraction of the lung. The comparative percussion of the lungs. Continue. The pathological changes in the percussion sound. The bulk sound determined by emphysema. Tympanic sound determined above the lung cavity like a tuberculosis cavity or impinging of the lung abscess. Now let's talk about topographic percussion of the lungs. So the goal of this type of the percussion is determination of the upper and lower boundaries of the lung. Second goal, it's a determination of the respiratory mobility of the lower edges of the lung. So how they are moving. And identification of the surface area. So this is a first main goal to the topographic percussion. Again, on the picture you can find what we say Koenig fields. So this is a Koenig, is one of the German scientists who found this is a fields of upper part of the lungs and how you need to perk out that. So you can find this on the picture. And in this picture also. So upper lung borders in the normal front 3.5 centimeter above the clavicle. On the back of the spinous processes in the 7th cervical vertebra. The width of the Koenig fields is 4-7 centimeters of the both sides. So every time remember that. Now on this picture you can find the lines of the topographic percussion of the lungs. So you need to do the carefully percussion exactly on these lines what's showing on the slide. Because if you're doing will be not of these lines, you will find different sound because we have a clavicle, we have a scapula behind the back. On this picture you can find how you're going to down to determination of the lower branches of the lungs. So one trick when you need to do that, so the trick, when you found the lower border of the lungs, you need to ask the patient to breathe very high. So he's breathing, the lungs is increasing the size, and you're doing very fast again percussion, and you again found it another board, and you point and you mark it. Looks like you can mark it by your finger or you can mark it by your pen, and then you can find how the moving the lower parts of the lungs when the patient doing breathing in and breathing out, and how it's moving lower lung. So this we are finished with percussion, and the next lecture we will talk about auscultation of the patients. Please, again, this is a lecture a little bit shorter because mostly we're doing on the offline lecture, we're showing with the students how to do that and a little bit practice on the lecture. In the online, we can't do that. That's why please do this at your home. Try to do this on your neighbors, parents, and another family. And when we will meet you, the opposite or on the front of you, I hope you already show us what you learned at home. Okay, thank you very much. Be careful. See you on the next lecture.